And I'd like to start us off with a question for you, Michelle, that I think might help connect the beginning speakers with Katie, who spoke after the break. In what ways does the research that Katie spoke of inform how you train people to better work with children experiencing trauma?
Well, I'm still thinking about the rats. Seriously, I mean, maybe this isn't an informed conclusion, but the idea that you take away half the bedding and it alters the maternal behavior, which affects the neurological development and the regulation capabilities of the infant rats, I mean, how does that equate to poverty? I mean, absolutely. And so, you know, that in terms of that intergenerational, I mean, I'm really very struck by that.
And I think that was really the model that the researchers were going for when they tried this intervention of reducing the resources, right? Here's a rat that's challenged by the resources in their environment. They don't have everything they need. And it's exactly what you were talking about, I think, when we were talking about families who, you know, are at the poverty line and are struggling with their everyday needs, getting those everyday needs met, let alone dealing with some of the emotional challenges that their family is undergoing. And I think that's exactly what these individuals are trying to model with these animal models, to show that there are direct implications for stress in these mothers and how that impacts their child's development as well. And I think the key thing to keep in mind here is that we're not saying that these infant rat pups will never recover from that. I think that just like we see in the human literature, there's a tendency for intergenerational transfer, that the next generation of rats tends to be of that high anxiety, high stress model. But if we can intervene to help support these families or these rats, I think we can see that there are positive changes in that generation that can be transferred to the next.
And Katie, what might be your recommendations for policy based on that?
I am not a policymaker, but certainly we need to be supporting all of these resources that are there to support families. And of course, we don't want people living in poverty.
And is anybody telling the rats that they should pull themselves up by their bootstraps?
I think the rats are.
I'm so sorry.
The rats. No, I mean, I think it's a legitimate point, which is that we as a social society can recognize these things, and we still don't always act in a way that suggests that we understand what the implications are. Unfortunately for the poor rats, often these studies are done in total social isolation. So there's a maternal rat and her pups, and they're by themselves. They have no social support. They have not enough physical resources. They get enough food. That is the one thing that they're clear about in these studies, but they stress them out completely.
Are there questions here?
So I work with homeless teenagers aged 16 to 21, and so some of what you're saying directly applies to the teen parents I work with. Mm-hmm. But I'm wondering if you have any more suggestions specifically to that age population in terms of development and trauma.
Well, I like to think that, you know, with teen parents, we've really got this double whammy going because we actually are dealing with competing developmental agendas when we're talking about teenagers and young children you know, we're asking, again, if you think about the development of regulation, teens are notoriously dysregulated in terms of, and so now we're asking the caregiver to provide regulation for an infant when they're developmentally incapable of it. And so I think, you know, if we pay attention to that, how do we want to cultivate our supports around teen parents, acknowledging how extraordinarily primary that is, you know, that parallel process. How do we support and help? How do we co-regulate those adolescent parents so that they can co-regulate their children? And what alternative supports might we want to provide for the children while their parents are learning how to regulate? So that, because children can have multiple attachments and multiple caregivers that can provide, you know, a more healthier set of experiences. Did that answer your question?
Could you use a microphone, please?
I'm just wondering if you have any advice for working with traumatized teenagers, regardless of whether or not they have kids themselves.
Well, I think
it's applying the same process, but just looking maybe at kind of that the child, meaning the teenager, is developmentally probably still a child, and so creating some of those opportunities for regulation. A lot of the families that come to the nursery became parents as teenagers, and so their development pretty much had to stop, and so that they could attend to the needs of the child. So we're constantly looking at that as our parents, where they are developmentally is probably a lot less, and even so, they're still in their adolescence. So we're always looking at ways that we're working with the parent that mirrors that, so that there's always that process going on.
I think one thing that I would say from a brain development perspective is, yes, they're not entirely developed, but teenagers have a lot going for them. They have a lot of skills that they might be able to draw on if the circumstances are right. So if we can provide the safe and secure environment and the secure relationship for them, to be able to then talk about what are the skills that you're going to need to go on to the next phase, and how do you regulate yourself, right? They might need more direct instruction and could learn more from direct instruction about self-regulation, how important this is in their everyday environment, and how much it will impact their success in the venues where they want to be. So I think not underestimating how many skills they do have at their disposal, just recognizing that under the wrong circumstances you won't see those skills, but that they do have skills that you can't use in a 4-year-old. Right? There's a lot of cognitive resource in a teenager that could be drawn upon to help them discover what it is they need to deal with on their own, and to realize how they react. Just like the caregivers in the nursery situation need time to reflect on their own reaction to the situation, I think that teenagers may be more amenable to actually having that reflection process in place to see what it is that how they're reacting to the situation may not actually be helping them.
So that co-regulating relationship combined with using cognitive behavioral strategies in some cases to access the other direction.
And recognizing that when you're in extreme crisis of stress, those aren't going to work. I mean, they need to have a secure base. They need to have some relationships that they can rely on when they're in a complete meltdown of stress and they can't draw on those cognitive resources.
We do have a couple of questions, too, about working with older children. Your examples that you gave about language for children at the nursery was geared toward younger children and might not be appropriate or as in-depth as an older children might need. Do you have thoughts about how to do those same things with a child who's older than 6, who might be able to be a little more introspective?
Well, I think, again, the principles are the same. It's about relationship. You know, Bob Pianta has done some wonderful work on looking at in school settings what makes a teacher most effective. What are the factors that most reinforce a child's learning? Is it the curriculum that's being used? Is it the teacher's organizational strategies, her ability to manage groups of children, or is it the individual relationship between the student and the teacher? It's the relationship. So again, you know, these are school-age children, but over and over again, it becomes about the relationship. And the relationship is about, in many ways, co-regulating. I don't have to get stressed. I can keep, you know, my cortex available if I have confidence that there's a regulating partner in this room.
And I think one of the hardest pieces of that is probably that as children get older, our own reaction to their perceived bad behavior or whatever, our reaction to their reaction is much harder to regulate. And there does come a point where, you know, I'm not physically threatened by a 2-year-old, but I might feel threatened by a 16-year-old. And so I think there does have to be some change in how these are implemented, but the basic ideas are the same, that everyone needs secure relationships in which to work through these issues and to develop the skills.
And some of these kids haven't developed the language that they need or the understanding of their feelings, and so naming them, I think, is a really helpful process, even if it feels like it's pretty primitive, and also acknowledging their feelings and recognizing that maybe that hasn't happened. So.
I was just wondering if you could say the article or the researcher you just referenced about relationships.
It's Robert Pianta, Pianta. He's at the University of Virginia, I believe.
I believe that's right.
Formerly of the University of Minnesota. And he's developed an instrument. Have you heard of the class? It's a way of measuring relationships in the classroom. That's Bob Pianta and colleagues.
Thank you.
More questions?
Hi, I have a question for Katie. As an adoptee and adoption professional, your research that you're doing with orphanages and international adoption, first question, what countries were you examining? And second, will you be following up with these children as they become adults? And are there any indicators for medical and mental health issues that come up in teen years and adulthood?
Great question. So our project right now is looking at children who are adopted from all over the world. The majority of our sample, we take anyone who's been internationally adopted in Minnesota whose family wants to participate in the project. This particular study that we're doing is a subset of all the individuals who are on our registry, all the families that are part of our registry. And it has to do with limiting some of the factors that we can't control. So if we know that a child had some severe medical issues early in life, they're excluded from our study, or if we know that they have had autism or developmental delays that are frank, we don't include them in this study because we're interested in high-level cognitive skills and they might not be able to perform them. In terms of the majority of our sample come from China, from Eastern Europe. We have some from South America, not very many right now from Africa, quite a few from Southeast Asia, India. So we're really trying to include anyone who's been internationally adopted to Minnesota. One of the things to keep in mind about our study is that we're really taking advantage of the fact that the families who volunteer to participate in this kind of research are so motivated to promote their child's positive development that our study is really in thinking about why is it that some children who seem to have experienced a similar kind of deprivation, as much as you can assume that, some of them are doing beautifully, they're thriving, and some of them are struggling. And so we're really trying to understand individual differences in adaptation and how it is, what domains can we target for intervention and early identification to try to help promote the positive development of those individuals. And there is a wide range of success in these families. There aren't very many studies yet looking at long-term outcomes, and so ours is one of the first to be looking in adolescents. One of the things we're concerned about in this is whether or not any of these children are at higher risk for developing anxiety specifically, or perhaps depression. So far, we haven't really seen that in our sample of 12 and 13-year-olds. It's a little bit early for some children, but keeping in mind that all of these children in our study were adopted prior to age 5, and they've been in their adoptive homes an average of 8 or more years. And so they've had a very positive environment since then. That doesn't mean that they won't have anxiety or depression, right? Plenty of us out here have anxiety or depression, and we have perfectly reasonable homes. So we're just looking at whether the risk frequency rates and things like that, or whether or not there are specific characteristics that might help us identify those that are at highest risk. So far, there are very few studies looking at cognitive and socio-emotional outcomes in adulthood. There are some looking at aspects of identity development and things like that have to do with mixed cultural families that are extremely important issues. And I will say that I think 100% of the families in our study are Caucasian families that are adopting children from all over the world. So, there's so much room for really interesting work to be done about the development following an extreme situation. and the impact that positive environments make. I mean, one of the things that's hard in our studies is sometimes you find no differences. And you're like, well, that's a bad research study. And I'm like, no, that's great. That's great. What it means is that there are some domains where these kids have no issues, where there's no evidence that they're any different from kids growing up in their biological families in Minnesota, and that's really terrific. So there are certain aspects of cognitive function that tend to fall that way. Children show a lot of catch-up growth in things like language, and social interaction shortly after coming to their adoptive homes. Some of them continue to struggle. Some of them struggle with relationship issues like attachment and forming those secure bonds so that they can use that co-regulation environment. And so we do expect that there may be a higher rate of some emotional disturbance. But we seem to be a little bit too early. We plan to follow these children further into adolescence and to look at other factors as children have to advance into more and more independence. One of the things that we see in some of our children is they seem a little bit younger socially. Physically, not so much. Some of them are a little bit advanced physically, but socially, they seem a little bit younger and a little more immature. And so we're interested in whether or not those things start to interact as they approach adolescence, where there are all kinds of new challenges, both socially, academically, but also in terms of developing independence and their own romantic relationships.
Katie, you made reference to things that could happen in research. I'm wondering if you could say a little bit more about potential next steps in research, given what you know from your own work and other people's work, and also what you hear from people doing this type of work with kids experiencing trauma.
Yeah, absolutely. I think one of the biggest things in the research environment, the newest direction that all of the funding agencies are really pushing toward, is thinking about intervention. How do we test whether all of these interventions that people are using every day, methods to try to help these kids, are actually having an impact in the brain or in their specific cognitive functions? And it's challenging work. It's hard to get enough funding to do this kind of work and to do it well. All of us struggle to find the best way in a laboratory environment to study things that aren't neatly packaged. Right? Even just thinking about the international adoption work, there are so many factors that we cannot control. We just have no control over the prenatal environment of these children. We don't even, not only can we not control it, we don't even know what it was. We can't even measure it, because by the time we get to these kids, their families have their best guess at how good the orphanage was, what the quality of care was, and that's about the best we can get. We don't have any information about the prenatal environment, the genetic background of these individuals. I think that's another direction that some of the work is going, is really trying to see whether or not we can use other biological measures like genetics to look at individual differences in response to intervention or response to treatment. And it's not as a way of saying, oh, these kids we can't save and these kids we can. It's nothing like that. Just the idea that there are variations in all different kinds of genes. So for example, one that we're looking at is a gene that codes for something called brain-derived neurotrophic factor. It's just a big name for a growth factor that's naturally in the brain. All of us have it, but there turns out that there's a natural genetic variant that just all of us vary on. It's not based on your family history, and it's a naturally occurring variant that within the same family, some people might have it one way and some people might have it the other. It's a polymorphism. And we're looking at whether or not that gene, which seems to affect the amount of this growth factor that's available, might interact with the kinds of trauma that the child has experienced. So how much deprivation did these children experience? How long was their orphanage stay? And their outcomes and their ability to perform on these different tasks. So I think we're trying to use multiple methods and to be more informed by the people who are out there working with the kids, saying, what are the issues we need to study? And the hardest part is that researchers like me are really hesitant to talk to people who are really out in the field, because we know that what we're studying is so minute compared to what's actually out there, that it's really scary to think about making a big judgment from what we found in one study to people in the real world. And yet that's exactly what has to happen. We have to be able to hear what are the issues that are out there, trying to tackle them in whatever small way we can, and then bring that information back. And so I think that's exactly where workshops like this are trying to take us, is to really bring together the research and practice and to get us talking to each other.
Great. More questions?
Hi. I was just going to make a comment from what the young woman was asking about working with teens who've experienced trauma. And I think one of the things that we can do for both teens and adults is to educate them about the impact of trauma. So that, I mean, they must be thinking, why am I thinking this way? Why am I acting this way? What's going on with me? Am I crazy? Am I experiencing, am I mentally ill? What's going on with me? And there's all sorts of stigma around mental health issues, and I think especially with teens, but also with adult women and some of the parents you must work with, that providing that education piece to them, that this, even with that mother you were talking about, that you experienced a trauma trigger in that situation, helping them understand the impact of trauma on them, I think would be a really helpful educational piece to any kind of program that anyone's running with people who've experienced traumatic backgrounds. It can really normalize mental health issues and say what you're experiencing is really a normal response to trauma.
You make perfect sense.
Thank you
right?
for offering that, because that is part of what
Right.
the work that we are trying to do better. In our home visiting program, we do a lot of that, and the normalizing and validating. I think which we talked about a little bit, but just really, really stressing the impact and
I think with teens that could be really powerful.
Exactly. Thank
You're not
you.
crazy.
No.
It makes sense.
Right.
to
There's
be
a
able to
reason why
hear
these
that
things
would
aren't
be
connecting.
So
Yeah, exactly.
reassuring.
I have two quick questions from Grant County. One, as a follow-up for you, Molly and Michelle, which website is the Early Indicators of Progress-based tool posted on?
The Department of Health, Public Health. So it's the DHS website. I think they were direct.
It's Department of
Sorry.
Human Services.
Sorry.
Or it could be Minnesota Department of Education. Or it could be the Minnesota Department of Health. Does anybody know? It's not health. Okay, it's not health. So I think it's
It's
the
the Department of Education. I am so sorry. Yep, Early Indicators of
MDE,
Progress.
Minnesota Department of Education.
In 2000, I believe they were derived in 2007. Is
Yeah.
that correct? Yeah.
Yep.
So, if you have any trouble, you can email me and I will find it for you. So.
We'll make a point of putting it on the blog.
Yep. Because
and
they're
the-
very helpful.
The other question from Grant County is for you, Katie. What test was used to view the brain activity during different tasks?
Yeah, this particular slide that I showed was during a cognitive control task. In this task, children were just viewing numbers on the screen, the numbers 1, 2, or 3, one at a time. And they were told that in one condition, that every time they saw the number 1, they were supposed to press with their index finger on a button. When they saw 2, they pressed with their middle finger. When they saw 3, they pressed with their ring finger. So it's a simple mapping of their fingers to the digits 1, 2, and 3. That's a very simple task. All of us can just sort of naturally do that mapping of 1, 2, 3. And then what we did was we changed the rule on them. We said, okay, now in this round, whenever you see a 3, you're going to press with your index finger. When you see a 1, you're going to press with your middle finger. When you see a 2, you're going to press with your ring finger. And it's very challenging. Not only do you have to remember the rule, but you have to inhibit your response to the overlearned easy form and perform this task. So that's what kind of a cognitive control task it was, what that was engaging in prefrontal cortex. Yeah.
There's a question here.
What I'm gathering from what we've learned today is there's a lot of intensive one-on-one work to be done with these children. And I'm wondering if you have any advice or carryover for those of us who work with groups of children at a time, where there may be only a few, I'm thinking in a classroom, in the art room, something like that, where there's clearly a few children who exhibit behaviors and all, and it affects the class and it affects everything. And it's like, how do we address individual needs when you're working with groups of children?
That's
the question, isn't it? Thanks a lot.
No,
Well, they are groups of children in the nursery. It is not one-on-one. Right.
Our focus is not to teach the children. Exactly. Yeah.
Yes,
exactly.
Absolutely right. Sometimes I think that we can be more explicit about including, I like to call it emotional literacy, in our curricula. so that we talk about feelings. We talk about what do we do when we feel this way, and what are some ways we can calm our body, and we make some of those regulation things explicit. It's almost like we give children a chance to rehearse so that when the moment comes, we can trigger that language and I think there's not enough support for that. I mean, that is a policy issue. That's social emotional foundations of learning, so that so much is not, so that is at least on an equal par as how well you're learning to read. But that still doesn't get to the question. I think it's more about, so there are certainly policy level issues, but I think there are curricula out there, depending on the age child, but more it's mindfulness and intentionality in the providers who have to be supported to do that, because that is really, really hard work. And I wish I had a better answer.
I think also it's giving the people that are working with the children. I know some of the Minneapolis public schools that are working with some of the higher risk kids. They have done some of these workshops with their staff, kind of looking at things using Ann Garrity's developmental repair model, and which is very similar, but in a different way. I come from education long ago, and so I totally understand, and most of my best friends, my sisters, everybody that I know are teachers, and we always talk about this, and they're like, yeah, but I do think that it's important to think about understanding what's underneath. It definitely makes it harder when your focus or a teacher's focus, they have outcomes that they need to meet as far as education, and these few kids that may be holding them back are really making it challenging. But I think that it's a way of being with the children is what I think is what's learned in kind of going through the training process. And doing it as a group, and it's not one training, I'm sorry, it's ongoing, and it's providing that space afterwards to work through some of these issues. So it's a lot of the same concepts. It's getting everybody on board. It's saying, okay, we're gonna look at this differently, and then taking it on as a year-long project is how I would encourage it to happen on.
And I think in addition to this idea that everyone has to be on board, so if there are multiple teachers involved in different aspects of this child's day, they all have to be kind of modeling the same thing. So you get back to that notion of predictability and stability and the ability to trust these adults as a stable relationship. That this is in school, this is the way things happen.
And that the adults can trust each other, that it's a continuous process.
Right.
So.
Yeah. But it's certainly no straightforward answer.
It's not easy.
I have a couple of big systems level questions. First, how do we infuse these program elements throughout the childcare system, given the current capacity of time, knowledge, expertise available for training and consultation, et cetera?
Well, I think there are some initiatives happening in the state. There's the quality rating system, which is just a piece. Some of the consultants who are employed in those kinds of projects are also getting additional opportunities to engage in reflective processes and expanded social emotional learning. But I think we have a long way to go.
Yep.
Yes. Example? You have an example? Okay, that'd be great.
I'm from Minneapolis Public Schools Early Childhood Special Ed program. Hi, you were my teacher. Anyway, I just want to encourage programs. We developed a reflective supervision program in our program, and it all came from the grassroots. If we would have kind of waited for the administration to take charge, I'm not sure it would have happened. And so I do think it can come from individual teachers if they sit on the staff development committee or they have a hotline and a good relationship with their administrator. And it can happen, and it grows, and it takes a long time.
And there's a lot of evidence out there that can prove that this makes a difference. And
there is research available in articles.
That's what we need to continually draw from, because if we can prove it, it becomes much more fundable, and it becomes much more an important task to take on. So the research is really, really, really helpful in understanding it and putting it into language in front of people that can really take this on. So
I mean, it's taken our program. We've had it for maybe 6 or 7 years already, but it's really taken off now, and so that's like 10 years later.
Yeah.
Oh.
Yeah.
But people are on board,
It counts.
which is
Yep.
exciting, and our administrators are on board, and they make it a priority now, which is exciting.
So it's not like it's kind of like when we say, if you're going to work with the child, you have this much time, but if you work with the family, you have this much time. The same is true for us as providers, right? I mean, all of that support and building and reflective opportunity is going to go a long way. It's an important long-term investment, right?
I have a question that's specific to child protection. Molly, you made a comment about your interfacing with child protection in situations where that's needed. The question is, how well do case managers and child protection understand trauma triggers for parents? Like in the example of the mom with the belt. How much would our approaches and care plans with the parents change if we had a better understanding of that? I know that's not your direct area of work, but I wonder if you might be able to comment on that.
I think there's different counties approach it in
Go get them, Molly.
Different counties approach it in very different ways, and I think that they really want to understand what's going on, and they are in their work because they care. I say that with all good intent. I also think that there's lack of funding for those resources as well, and so they're strapped with huge caseloads with very, very, very challenging situations, and they have a very short amount of time to get done what they need to get done. So this work does not happen quickly, and unfortunately, the expectation is that it should happen quickly. You got to get in there. You got to develop the relationship, and by the very nature of child protection, it's not a voluntary relationship, so families are automatically resistant to those systems. They're going to fight tooth and nail. Some of their worst responses will come out, and then that just snowballs into more and more. So I do commend people that can work in child protection. I'm awfully glad that I'm on the other end of it because it's a lot more gratifying, and I think we have a lot more opportunity to make a change. So I don't know if that really answers the question. I think that there has been some work done, I know in Hennepin County, to look at the trauma and its impact and how it's more about the response to the trauma and how they can do work around that reunification, that rebuilding of the attachment. So there is work being done, definitely, but I think that they are at a very great odds. So.
And I think there's tremendous variation in terms of how much individual protection workers understand these dynamics. But then that becomes, it's like Molly talking about how to engage the nursery. There's the grassroots, but it also has to be top down. It has to be administrators. It has to be policymakers. It has to be funders. I mean, it has to be the system to make it happen.
Think of the image that Michelle had earlier on. It's all of us. It's all about collaboration. So, but we do work very. We partner with Hennepin County in a very positive way. So they respect our work, and we definitely respect the work that they do. So.
This is a good place and time for us to wrap up. I want to thank you all first of all, for your questions. I know there were several other very specific questions about the way the nursery operates. We will address those on our blog. I know there was a question about a website with resources, and I understand that's under development, so we'll get to those questions. And then a couple of announcements before we leave. First, that you can reach that blog on our website, cmh.umn.edu. And for those of you in the metro area, that's on your folder on a sticker. And please complete an evaluation form, and there's a place to drop that outside the door, and pick up certificates of attendance. For social workers, you can access the post-test for this event on our homepage, that same website, and after you submit that, we'll send you a certificate of attendance. I want to thank you all for coming, and I want to thank our speakers, Michelle and Molly and Katie. We hope to see you at our next event.